Doctors of Reddit, what's your thank god they came in for a second opinion moment? Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine that were melanimous. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. It can definitely be intimidating to have someone basically inspect every inch of your skin, so I understand why people are reluctant, but it's so important. Melanoma is no joke. Recently I made an appointment with a new derm for a painful cyst that wouldn't go away. I decided to have them check me all over since I was there, and it had been a while. I'm female, the doctor was male, about my age, and had a trainee with him who was also male. Younger me would have been mortified, but 41-year-old me was like, cool, where's a gown? Y'all are just doing your job and being professional, no need to be embarrassed. I'm a semi-retired physician and I don't believe in second opinions. I much prefer 2 first opinions. This is an important distinction, because often if the doctor forwards your file to a different doctor they'll flavor it with their interpretation. As a mental health patient this is one of the most infuriating things imaginable. Once you're diagnosed that's it. No one will ever look at the evidence again. They'll just assume the previous person got it right and then add whatever you say to that. But the original diagnosis was about 10 doctors ago. So basically I've gone to the GP, told them what's wrong, had them write it down, and then another GP has come along and read what they wrote and reinterpreted it, and then another does the same, then another. I no longer have any confidence that my diagnosis is even remotely correct, because the doctors have basically been playing rumors with my file for a decade. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. I have a male friend who was diagnosed at age 16 or 17. Apparently these are extremely rare cases, male and young. Yes, I'm not saying the other doc should get a pass or anything, since he could have run other tests long ago, but I suppose I could see why manuscript wouldn't be something he'd really think of initially. I'm pretty sure that, even if it isn't something you would catch, reaming out a patient because you think they are pretending to have symptoms is pretty unprofessional. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctors said the replaced hip was fine. We finally made her go to a private clinic in my hometown, and the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected, and she would have died. Thank goodness she went to the clinic. The replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. I like to imagine he said it exactly like this. It reads like a Monty Python sketch. A tad bit eaten by bacteria. A bulk of my career lately seems to be maligned patients with legitimate medical issues who've been labeled as hypochondriacs and sent through for a psych workup and meds counseling. People with histories of all kinds of endocrine issues, like thyroid cancer, thyroidectomy, patients who see someone once every 2 years about their thyroid and never have labs checked or med dosages fixed, or diabetics with poorly controlled sugars People who've had bowel surgeries and take time release meds and then wonder why they aren't working. The piecemeal system of healthcare in the US is really doing such a disservice to actual humans. So many specialists and no one piecing together the big picture. Former volunteer here. An elderly gentleman was brought in by his concerned adult children for chest pain. He wanted to believe his primary doctor that it was just some gas or heartburn, but his son just had a gut feeling and made him go to the ER with everyone so he could get checked out. Heart attack was imminent, like, we weren't sure if treatment would take effect in time to prevent it. Declared code blue, all hands on deck. Place went from a quiet, empty ER to sheer chaos in a few minutes. There is no doubt in my mind that that gut feeling saved his life. My friend's mom had nausea and was extremely tired. My friend insisted they go to the doctor. Mom refused. My friend just knew it was a heart attack, so she called their neighbor who is a nurse, and sure enough, as soon as the neighbor walks through the door, her mom collapsed. It's been 4 years. Mom's great. Quit smoking, retired, lives the life, and still makes the best potato pancakes I've ever had. Don't ignore your gut feeling. This guy was told he had pink eye. He had metal shards in his eye from welding. This woman came in through the emergency room with a chest pain. She visited her GP 2 times already, Monday, Wednesday. He treated it locally with subcutaneous anesthesia injection lidocaine. Turned out she had huge myocardial infarction, as we told her what we think it is, and that she needs immediate coronary intervention. The stress caused further contraction of the closed coronary vessel, and she had a systole right there. After circa 2 minutes she jumped back on, and we could eventually save her, although her heart was damaged after this. But the follow-up showed improved heart performance, so she got that going for her, which is kind of nice. This is a I wish I had gotten a second opinion story. I had a doctor in high school who wasn't concerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially and lost 60 pounds for no reason. It was only a year or 2 later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class that he thought there might be something wrong with me. MRI ordered. Brain tumor found. My dad went to the same ear doctor for around 9 years due to poor hearing and was told there was nothing wrong. When he finally went to a second doctor, they referred him to the hospital and found tumors in his ears that had eaten entirely through his inner ear bones and eardrums. He needed 4 ops to remove them, 1 every 6 months. If the second doctor hadn't offered their opinion, he would probably have had tumors eating through the back of his skull into his brain. I asked my internist what the cause could be for weird tingling sensation in my left arm could be. She told me it would probably go away. Half a year later I got diagnosed with a brain tumor. Now I've been cancer free for a year since surgery, but still, could been better maybe. If I wasn't sent off with it'll get better. Had someone come in one day suffering from sudden onset confusion, delirium, and panic. They had massive colon issues that needed to be sorted out. They had used the colon incorrectly when introducing a list of items in an essay, and I wanted them to review the rules of correct usage. All fixed in the end. I'm a PhD. My mum was pregnant with me and went for a scan to see if I was in fact a baby, and the doctor said there was no baby. They went for a second opinion and found me. That was lucky. Imagine if they hadn't found you, you'd be stuck in there forever. Any hypochondriacs reading this, hit me up. Currently 100% sure I have cancer and everything else. Did you know that doctors don't Reddit and just let their friends tell their stories? I'm not a Redditor, but my friend is, and he tells me this happens all the time around here. Young man lost his hearing in his right ear suddenly. Doc told him it was allergies. Allergy medicine didn't make it better. He had no allergy symptoms. A year later he began to experience jaw pain on the same side. His doctor told him it was probably a toothache. He came to the hospital for a second opinion, and it's a giant brain tumor, scheduled for surgery within the week. You honestly lose track over the years. Seems like with every patient the more attention you pay, the more unsorted missed things you find. Heart failure that is actually pneumonia. Oh look, that elective surgery patient, nobody has listened to the chest of sounds. Like she has aortic stenosis. No, it's not usual for your potassium to be 2.4. You have a problem with your kidneys and we should do something about that. I don't think Reddit has a word count large enough. I'm a doctor of fine art. Had an intern come to me to discuss a recommended cleaning solution that the overseeing professor had told them to use on an extremely expensive painting we hold in our storeroom. To cut a long story short, this cleaning solution would have completely bleached said expensive painting. Second opinion here saved us an awful lot of money if nothing else. It turns out the professor had appallingly bad deterioration of eyesight, but was unwilling to admit it. Hardly surprising given our line of work. I was told that this was just a really dark-skinned guy biacidit, melanoma. Stage 5. More specifically, breast loss depth of 5.4 millimeters. My pathologists told me it was the worst melanoma that they have ever seen in their entire careers. Get your moles checked, Reddit. I can't stress this enough. Stage 5, not stage 4. Psychiatrist here. A 30-year-old man with mild depressive symptoms was in and out of the hospital fairly quickly. He was under pressure from his home life, living with 4 roommates who were making life a bit difficult for him. No suicidal thoughts. He was cleared of all psychopathologies by me and 2 other doctors. A few months later he came back. Same symptoms. However, this time he talked about 5 roommates. It felt wrong, and I digged in his story. Tried to contact his roommates. He lived alone and was severely psychotic. I have no idea to this day how he hid it so well from everyone. My dad, a pediatrician specializing in neuro issues, was seeing one of his patients at the hospital, got dragged into the NICU unexpectedly by a nurse who insisted a baby wasn't well. The attending doc insisted the kid was fine and just tired from a difficult vacuum assist delivery. My dad could tell the baby wasn't okay and managed to talk the parents into a brain scan. The NICU doc insisted my dad was nuts to the parents. Dad was right and the kid had a brain bleed and was rushed to surgery. The baby would have died without the nurse bringing my dad in and the parents listening to him. As is, that extra time almost certainly cost brain function. Was about to tell a patient to go home and rest from running and carefully stretch his groin. Colleague came in and noticed that the patient had testicular cancer.